Alright, we're going to talk a little bit about tibial internal rotation, which is a little mobility piece that I find really limited quite often in CrossFit athletes, runners, weightlifters, or just athletes in general that have knee pain, calf pain, or ankle problems. So to talk about this, we're going to use my knee as a little demonstration. Here you can see up top I've got a line representing the midline of my femur. I've got my kneecap outlined. This little triangle piece is my patellar tendon that connects my kneecap down to my tibia. And this little line right here at the bottom represents the tibial tuberosity. The tibial tuberosity is the most anterior piece of bone that you can find on the tibia when you're right below where the patellar tendon inserts. It is like a little ridge that you can pretty easily find with your hand. We're going to look at the angle of this tibial tuberosity in relationship to the midline of our femur. And what we like to see there is the ability to have 20 degrees of internal rotation of the tibia relative to this femur mark. So what we do here is I'm going to twist my own knee and pull in. And when I'm in this in position, I can feel with my hand where that tibial tuberosity is. And right now it's pointing inward just a little bit, and in relation to my femur, I've probably got a 20-degree angle. It's really hard for you to see on the camera, but when you're looking straight down at it, you can tell that angle out. 20 degrees of internal rotation is really what we want to have. If you don't have that, we've got two different treatment options that usually fix that really quick. The first is a self-treatment. You start on your hands and knees. I'm going to get my toes pointed in towards each other, and I'm going to just sit back onto my heels. So from the back view, you can see those feet are turned in, and that's the motion that you have. I've got another trick I'll show you in a second for how to do that on a patient. So if I'm doing this on a patient, I get them in this bottom position of a lunge. I'm going to grab the proximal tibia right below where the patellar tendon inserts onto the tibia. I'm going to internally rotate them a little bit, just providing a little bit of twist, and then have the patient or athlete bring their knee as far forward to me as they can and back out. I usually do between 3 sets of between 10 and 15 reps of this. I usually will take a voodoo band or an edge mobility band sold in the manualtherapist.com and wrap that around this proximal tibia. It gives me a little bit more to grab onto, gives me a stronger surface, and also makes it more comfortable on the patient.